Hey everyone, it's Reena Jadhav here at HP Vader Splash Shacks, and we're chatting with Jim McCarter from Virta. Hi there, welcome.
Thank you, Reena. Nice to be here.
So what brings you to precision health today?
Well, I think when Virta Health thinks about precision health or precision medicine, what that means to us is two things. One is individualization and real-time response. So what we do with our patients, we're a medical provider, is to provide what we call continuous remote care. Meaning it's like having your own doctor and health coach in your pocket and respond to people's biomarkers and needs in real time.
Explain to those who don't know Virta what an amazing company you've created. Describe a little bit about how it works.
Sure. So the mission of Virta Health is to reverse type 2 diabetes in 100 million people by the year 2025. And when people hear reverse type 2 diabetes, that's a sort of a shocker. People think about it as a chronic and progressive condition. But we've shown actually that through behavior change, you can actually reverse the indications of the disease so that you can get glycemic control or blood glucose control without the need for medication. And the way we do that is in two regards. One is the continuous remote care model includes 24/7 access to a health coach. It includes telemedicine, so remote care from a doctor in real time, an online community that's providing peer support, nutrition and behavior change education, and biometric feedback. And then the other thing that we're doing that's unique is the actual Virta treatment or Virta intervention is very different from the kind of usual advice that people get around nutrition and behavior of eat less and exercise more. That's not what we're telling people.
Now you're head of research. What is the most exciting research results you've seen lately that you'd love to share with everybody?
Sure. So the reason I joined the company 3.5 years ago is that unlike some technology companies that are really built around features and are kind of a consumer-driven adoption model, Virta's built around outcomes. And there was a commitment from the company very early on to doing clinical trials and doing clinical research. Two of our three founders come from an academic medical background and had hundreds of publications in the field. And so what we set out to do before we actually commercialized was to conduct a 500-person clinical trial in central Indiana, including over 300 people in the intervention arm of our trial that have either diabetes or other metabolic diseases, and then looking over the course of 2 years at what are their health outcomes. And so the big news of that is that unlike conventional care where you see reversal of diabetes in a very low, less than 1% of people, we see actually greater than 60% of our patients are reversing their type 2 diabetes, getting off their meds.
Incredible results.
Yeah,
incredible
really,
results.
Really incredible.
How are you able to create that precision wellness or precision health model that allows you to scale across such disparate populations, disparate age groups? What's the secret there?
Yeah, so one of the things that we've built is that if you think about our health coaches as taking care of a certain number of people, our physicians taking care of a certain number of people, if we were to try to do that in a bricks and mortar situation, you know, people would have to kind of travel in for classes, and you could only scale it to, you know, a few dozen people per health coach and a few hundred people per physician. What we can do by putting technology underneath our care providers is really give them superpowers. And so by having a remarkable engineering, user experience design, and data science team, we can make sure that, for instance, our health coaches, every day that they start their day with prioritization of their patients. So based on the daily biomarkers of measuring things like glucose and ketones and weight and other trackers of health, as well as the patient interaction with the health coach, they start their day with a prioritized list of which patients need their help the most that day.
So you're providing that additional support.
Providing that, and then for another example of that would be that our physicians are actually making medications changes in real time. So we actually, in the first 70 days of the intervention, are deprescribing the majority of the medications.
Which is the only way you can actually help reverse diabetes, is you've got to take them off the meds.
That's right, and we do that on a daily basis. So instead of coming in and seeing your doctor after 3 months or after 6 months, and the doctor saying, okay, we're going to make these changes, the metabolic changes of health improvement are happening so quickly in our patients.
How quickly do you see that?
Like within days.
You see them within days?
Yeah,
incredible.
we actually reduce or eliminate 94% of the insulin.
What's the biggest driver in that?
Yeah, the early changes are around nutrition. And so what we're actually doing is using a ketogenic diet, which is one that is low in carbohydrates, moderate in protein, and higher in fat for energy, either coming from dietary fat or from body fat stores. And so as people switch from that carbohydrate burning to fat burning, they're making a whole series of metabolic changes in gene expression, and then that leads to the corresponding improvement in health. And people will see their blood glucose come rapidly under control, and so they'll, hey, no longer need the insulin.
Now, I don't know if you've been online and you've been tracking all the fun debates around keto versus plant-based diets.
Sure.
Are you recommending a vegetarian keto or a plant-leaning keto, or are you okay with the
Sure.
the salmon and the chicken?
Yeah. So one of the nice things about Virta is that we individualize. So we want this to work for everyone, no matter their dietary preferences or cultural or religious background, or whether they're cooking for a large family or traveling for business or working the night shift. It has to work. And so what we do is we're not giving a one-size-fits-all recommendation. We're giving a very individualized series of recommendations. Do
you plan on ever getting into food delivery business at all? Like, here's not only just what we recommend you eat, but here's actually the food itself?
Sure. So the primary thing that we are is a medical provider. So we practice telemedicine, and we're a licensed medical provider in all 50 states. We partner with self-insured corporations as well as with health plans to deliver Virta as a medical intervention. And so we see opportunities to partner with others for things like that. That wouldn't be necessarily our primary business. But anything that can make it more convenient for our patients.
That's exactly right, because there's a huge fallout typically in any program from telling someone, this is what I'd like you to eat, and them actually eating that.
Yeah. So
how that's
one thing that people find that's the trouble is sustainability. So oftentimes somebody will do something for a few weeks or a few months. So we've got results out now. We published the 1-year results a while back, and we're going to be publishing the 2-year results of our clinical trial.
And what's the secret? How do you make that happen? How do you get people to stick to your program?
So two things. One is with that continuous remote care model, you've always got someone there for you. You've got your peers in the online community. You've got your health coach. And so when people get off track, we can get them back on track again. And then the other thing is that when people get the nutrition and metabolic changes right, they actually feel better. And so they're very motivated to stay with it. So they'll say, not only have I lost 30 pounds and decreased my hemoglobin A1C and gotten off my meds, but I actually have more energy.
Exciting. All right, last question. What's new for Virta in the next 18 months?
Yeah, so what we're trying to do now really is scale the intervention. So we've shown that it works in the clinical trial, and we're now treating thousands of people around the country. And so for us right now, it is about increasing our capacity to take on more patients, and then growing. So being out there selling to health plans, selling to self-insured corporations around the country. And for my team, it's about additional research and additional proof points. So one of the things we're really excited about is that we've created the Virta Health Registry, and so that all of our commercial patients, not just those in our clinical trial, are able to consent to have their anonymous medical information used for research and publication. And so we can share results not just from a few hundred people, but from many thousands of people.
Thank you so much.
Thank you.
You're doing great work.
Thank you.